Good morning, everybody, and welcome back to the Her Story TV and the Her Story podcast. This is Getrude Matshe here in beautiful Melbourne, Australia. And today I am graced with the presence of yet another sister from another mother. Welcome, welcome, welcome to our tribe.
Thank you. Thank you so much for having me.
Please tell everybody your full name, where you're
Uh,
based.
I am Tanya Destang-Beaubrun, a family physician specializing in functional and integrative medicine, and I'm based in the beautiful Caribbean island of St. Lucia.
Wow. I've been talking to women from all over the world. This is the first time I've had a guest from St. Lucia. And like I
Oh, see?
said when we were starting, I love the Caribbean. It
Yeah,
feels like home.
it would,
So, where
yes.
are we going to begin with your story?
Wherever you want to go.
So, tell us that pivotal point in time when your life changed.
Well, I tell the story that the greatest blessing, I think, in my life was being on the other end of a stethoscope. You know, as a physician, I'm always the one with the stethoscope listening. And there I
Yes.
was. I'm asthmatic and I was really having a bad attack. And on the other end of that stethoscope, I'm looking up at my colleagues and I see that look. And that's a look that I know with a little guiltily I felt at the time that I too had
Yes.
given to my patients. That look when you've done everything you can, you've run all the tests and you've given all the medication, and the person is not responding the way they
Yes.
should. So you think there's something wrong. So I saw that look and I thought to myself, this is how we've been trained to look at disease, not to look at the person
Mm,
beyond the disease.
yes.
And something shifted that moment. And I said, nobody's looking at me. I'm just an amalgamation of symptoms and signs, and
Yes.
that make up a disease. And I'm being treated based on whatever big pharma has as the latest drug regimen.
Right.
Nobody's looking beyond the disease and saying, okay, what's going on with her?
Mm-hmm.
What else could there be? So I decided there and then that I knew that I could heal myself, and I'm not telling anybody who's sick that they should do that, but I
Yeah.
knew then, because I guess I had the medical knowledge, that I had to take ownership of my health, and that
Yes.
I had to do what felt innately correct. So um, I then went in search of why, and one of the main things that I got out of this was the cough I had was a blockage in my throat because I was not speaking my truth.
Okay.
And that was like, whoa, where did that come from?
Yes.
What's this about? And then I went, the doctor in me, the conventional Western medicine doctor in me wanted an answer.
Yes.
So I then
Okay.
went looking and I was diagnosed with a particular form of asthma. And that's why, so for me, it made me realize that I wanted to be seen. I wanted to be heard. I wanted to be
Yes.
held in a safe space that moment.
Right.
But we were not taught to do that. We were taught to see the disease and write a prescription and, put
Yes.
medication in. But it's not done in this container where the patient feels truly seen and heard and even held. And I
Yeah.
once told one of them that what I needed more than the prescriptions and the medication was a prescription for love.
Oh,
I
wow.
said, I just needed you to see me. I just needed you
Yes.
to hear me. But you were listening to my lungs. You were not listening to me.
To
You were just
me, the
listening to my
person.
lungs. And it changed everything for me. I started looking into other ways of healing. Um,
Okay.
I then did a course in integrative with IIN and did a health coaching course. But the first person whose life was changed by that coaching course was mine.
Oh my
And the
gosh.
look just it all fell into place where I knew that there was more to medicine than just writing prescriptions and seeing disease. It made me look at the person beyond the disease, and it made me look at myself beyond the disease. I then
Yes.
went on to do an advanced fellowship in functional and anti-aging medicine. And whilst finishing that, literally something fell into my lap, which was a degree program in alternative medicine. I
Oh,
never knew
wow.
I never knew it existed, and
Okay.
it gave me 2 blissful years of emerging myself into so many different realms of different kinds of medicine, from the ancient, Eastern
Eastern
medicine,
medicines, yes.
traditional Chinese medicine and Ayurveda. They went into naturopathy, and also learning the histories of the
Behind it.
behind it. It filled me up so much. I then realized that, there was something beyond Western medicine,
Mm-hmm.
but Western medicine saves lives every minute of every day. Every
Yes,
single minute of every day, somebody's life is saved
it's being
by Western.
saved.
However, Western medicine is not very good at healing. So it's very good at curing. You have
Yes.
something, you have surgery, you take it out, you're cured, but you're not
Mm-hmm.
healed. So healing comes from within, and by looking
Yes.
at the person from a deeper place.
Yeah.
And that's where functional and the integrative and alternative and complementary therapies come
Come
in,
in.
blended with the science and technology that Western medicine gives.
Wow. It sounds to me like you have been on quite a journey, but the breadcrumbs
Yes,
were there, right? The
yes,
signs were there. You
yes,
almost feels like you were guided to find each and every one of these solutions.
yes, indeed.
So you got stronger at seeing the signs. I like to talk about women's intuition.
Oof, yeah,
A lot of times we don't listen to the promptings, we don't listen to those signs, and we don't trust ourselves.
yeah.
And your intuition is like a muscle. You use it, it gets stronger. And the stronger it gets, the more you use it. How does your intuition talk to you? When do you know this is a sign, this is something I'm supposed to follow?
It's almost like there's a knowing that it's just I just know. I literally just
Okay.
know. There's
Yes.
there's there's I can't even explain it.
Explain it. Yes.
So as I've gotten older, and
Yeah.
as I've started speaking out more and delving into more of the um, spiritual aspects, and what I actually left my practice 6 years ago to go back to school to study, and
Okay.
it that was the biggest moment of my life, to step out of my comfort zone. I had built a successful practice,
Yes.
and there I was saying, I'm going to leave it in somebody else's hands and I'm going to study this. But I knew there is I can't explain to people. Some people say you were running away. I said, no, I was running
Oh,
towards my truth. I was
oh
running
man.
towards something that I had no choice but to do it.
Yes.
And
Yes. It was
that was,
calling
it
you.
was calling me. And that was as
Hmm.
if everything opened up. And I just have this knowing that things are going to fall into place. And, I was
Yes.
telling you earlier that I opened your email.
Yes. Yes.
And usually Fridays I'm frantic all over the place, and I found a pocket of time and I opened this email and I'm like, oh
Yeah.
wow. So my faith and my intuition have been very pivotal in carrying me along this journey. They have these two, I call them pillars, have supported me throughout
Throughout your
especially the
life.
past 6 years when I stepped off the beaten path.
We have one of my friends in Australia tuning in on Facebook, Nina Angelo. It's good to see you watching us today. Nina said that this is really interesting. I wish there were more practitioners like you, Dr.
Yeah, I do
Tanya. Thank
wish.
you for what you do.
Thank you, Nina.
So, you doctors are trained to prescribe medication.
Mm-hmm.
They end up being legalized drug dealers, if you don't mind my saying, because
In
the
some forms, yeah.
pharmaceutical world is pushing for this.
Yes.
So there is a need for medication. How do you balance that out with using natural methodologies to heal and the pharmaceutical medication?
Well, I think the first thing is to look beyond the disease. So, for instance, diabetes presents with a certain set of signs and symptoms, and your
Mhm.
blood sugar is high.
Yes.
But why did this particular person have their blood sugar go so high? Is it their
Yes.
lifestyle? Is it genetic? Is there something else? Is the body trying to tell me something?
Yes.
So I go in depth and I look at everything and I have a conversation with them. So this is not, okay, you have this and I'm ticking you off. And because you've met the 5 ticks and you meet that criteria, then you have diabetes. And because I know you have diabetes based on whatever the latest drug regimen is, I prescribe it. No, what it is I go deeper.
Right.
Why did you get? So if it's something you're eating, what's the point of prescribing medication and you're going to continue eating and living that way? If it is a stressful situation in your life, then it's going to continue raising your cortisol levels and it's going to continue affecting your blood sugar. And all that's going to happen is in 3 months when we repeat your labs, your blood sugar will be higher and I'll have to increase your medication. So the joy of what I do for me is that I get to the root cause. I find out what's happening to the person behind this disease. What imbalances are there? Is it physical? Is it emotional? Is it psychosocial? Is it even spiritual? You just don't know.
Yes.
And when you start to ask the right questions, and that's the key thing, asking the right questions. When you ask the right questions, then you get to see. You sort of see, you ask a question and I guess I get this intuitive nudge. Aha. I asked that question and the eye shifted or something went wrong or there's a subtle change. Maybe even the hand moved and you said, I'm getting warm. I'm getting warm.
So it's almost as if you have to read the body language of your patient sometimes to get to the truth. You've learned to listen to the unsaid.
Yes.
Because most communication, they say 60% of our communication is our body language, not so much the words that are coming out of our mouths, correct?
It's so true. And I never realized that and a lot of what I'm doing now, I had started doing years ago in my practice, even as a medical student. But nobody taught me that it was okay. So I kept very quiet about it. You'd get an intuitive nudge, something is not right there. So you'd examine and you'd go and look.
And then you'd find that there is something there.
But there was nothing to tell you. So you just found it.
Okay.
And I now talk very freely about how my intuition guides me through everything. And most importantly, in the work that I do.
Okay.
Because I couldn't do half the diagnoses that I give to my patients. There's something beyond just looking at the patient and examining, just looking at the physical signs and symptoms. There has to be more. And I think we have to start in all aspects of life, in all areas, start looking beyond the obvious.
Yeah.
Or what we think. What we think is the obvious. Because what we think is the obvious is not always that. So that has just been it's been amazing for me, really.
Okay, now we're going to take a little commercial break. And when we come back, we're going to talk about aging and especially aging for women and longevity. So we'll be back in a minute. Okay, we're back again with Dr. Tanya all the way in St. Lucia. Welcome back, everybody. That was a small commercial to encourage you to sign up for our next online summit. Go onto our website, herstorycircle.com. We would love to hear your stories and share them with the world. So, Dr. Tanya, I'm in my 50s. I am going through the change. Very, very challenging time in a woman's life, something that most women are not really prepared for. We know it's coming. We've been told 1 or 2 symptoms here and there. And then one day you find yourself in there and you feel like you're going absolutely crazy.
Well, I am in my 50s as well. And I went through it already.
All right.
But I don't think it's a time where we should be afraid. I think a lot of women go into this time and they start to think that it's all about hot flashes and aging fast, and it's not. I think it's a time when we step into our power.
Mm-hmm.
It's a time when the body starts to do different things. But
Yes.
if we know that we own our bodies, and if we have been in tune with our bodies for a while now, and we've been taking care of ourselves, and we've been putting ourselves first, it's
Mm-hmm.
not as traumatic as people have to make it
Make it
out to
out
be.
to be.
That is my personal. If you start
Right.
preparing yourselves from even in your 20s, we think that we're invincible in our 20s. We can do so much.
Mm.
We may be starting our families, and so we put our families first. Then into our
Yes.
30s, it's career and families, and we try in this amazing balancing act that never works. And then reach our 40s, and then all of a sudden the eyesight goes, and you start to wonder, and you may see a wrinkle here or there. But everybody's looking at it from the outside.
Yes.
You're coloring
Yes.
your hair and you're doing everything. But we need to start looking at deeper at how our cells are working. And I think knowledge
Right.
is power. And if we start to educate young women on how their bodies work beyond just about periods and the usual, let's learn our cycles. Let's learn our bodies. Let's learn what foods work for us and don't, because not
Mm-hmm.
everybody can eat the same things.
That's true.
Let's learn what type of exercise works for us. Not everybody
Mm-hmm.
is a runner. Not everybody is, a yoga would work. So we have to start to get in tune with what works for each and every one of us.
As an individual.
It's individualized, and then
Yes.
as we get through the changes, I'm not saying it's easy. I've had my hot flashes.
Mhm.
Um, I think what worked for me is that I got it fairly early, so I didn't realize
Right.
it was a hot flash. I just thought it was hot.
I love
So
it.
I just thought it was hot when I was doing this. And
You're
then
one of the lucky ones.
I was getting them, but I just thought, oh, it's hot today.
Oh, I love it. I love it.
Because I was told that menopause begins in your late 40s into your 50s. And I actually
Yes.
started having it in my early 40s. So I figured,
Okay.
you're stressed and you have so much going on and it's hot. I'm in the Caribbean, it's hot all the time. So I'm just doing this and I'm fanning and, I have a night sweat and I take off I change in the middle of the night. Never occurred to me until I thought, oh, I'm perimenopausal. And then I
Oh,
and
I
then I
love
really got
it.
into the functional medicine aspect of how to treat my body. And I
Right.
started watching my cycle and preparing myself physically for it.
Yes.
Emotionally, honestly, I don't think I wasn't scared. And I wasn't
Right.
because I don't know, maybe I was too busy to be scared.
Yes.
You understand? I was working.
Yes.
I
You're
had the kids, and
working.
so I was working. I had my 3 children. I was, married. I have business to run. I was just too busy to be scared.
Okay.
So it was
Mhm.
happening to me, and instead of allowing it to happen to me, I took control, tuned into my
Yes.
body. I know what works for me. I knew what foods worked. I started. I did a lot. I started to do yoga and realized that I don't need certain foods in my life anymore.
Okay. So tell me,
Um,
what were the things that you cut out? Let's get
um,
really specific here.
Sugar, for me,
Okay.
I have a sweet tooth. So you put a
Oh,
cupcake in front of me and I will eat it.
yes. Okay.
I will eat it. But I
Oh,
realized that sugar didn't do well with me. I got bloated. I just didn't feel right after a while.
right.
Um, but it took me a while to say, okay, you need to cut back on sugar, processed foods
Yes.
as well. I was the usual, you pick up something and that's how you pick up a croissant for breakfast. And I
Yes.
thought that sugar, the processed foods, the wheat, didn't agree with me. I felt
Right.
sluggish. I felt bloated. I just wasn't feeling right. I wasn't
Right.
feeling vibrant. So I
Okay.
slowly started reducing what I ate. And
Yourself.
yeah,
Hmm.
I just started to reduce the amount. So what I would do is that I still wanted my cupcake, but I would have a big cupcake and cut it into 4 pieces. And I allowed
Okay.
myself a quarter every afternoon.
I love
So I
that.
didn't have as much of it. So I allowed, and I realized,
Yes.
you can do this.
Yeah.
And I
Yeah.
started investigating and looking online for recipes and realized I could have some coconut sugar sometimes. And I started following
Okay.
a lot of the paleo plans and using
Yes.
almond flour instead of wheat.
Weight.
And I
Uh-huh.
realized once I started doing that, everything shifted for me. My weight shifted. And there's a
Okay.
story that I tell people that in my very early 40s, I was working very hard. I was expanding my clinic, in fact, opening a new where my clinic is now. And I
Mm-hmm.
was working really hard and I was trying to keep up with the exercise, but I wasn't eating well at all. The
Okay.
cupcakes it was more than one cupcake a day. That was what was
Oh,
going on.
wow.
And, but my scale was saying it was the weight that, the world says I should be. But my
Yes.
clothes were saying something totally different.
Right.
My clothes were saying something totally different. It was a little tighter around here. You got a little bit of,
Yes.
tightness in the legs. The skirt wouldn't fit the same way. But the
Mm.
scale said it, so I was good. Until one day I went to my trainer and I said, something doesn't feel right. I said, oh, let me weigh you. I was 10 pounds over. My scale had broken.
Oh, wow.
My scale was broken.
Wow.
So I was so attached to that number of what
Yes.
the scale said. I
Yeah.
had just ignored the signs that my body was trying to tell me. I was gaining weight because my
Yes.
clothes were getting tighter. I wasn't
I
as
see what you
vibrant, but
mean.
you know what?
Yeah.
Once that number on the scale was good, I felt life was good. And it really was a big aha moment for me where I realized that I had to ditch my attachment to that number. And it's still something I'm working on. It's not as easy as I would like it to be. I still,
Yes.
monitor my weight carefully, which I think we should all do. Not that we're
Yeah.
totally
Yeah.
attached to it, but we should know, you go somewhere and you during the pandemic, we all had, I call it the comfort 10, which was a
Yes.
comfort 10 pounds because of cortisol, because we're eating badly, because some of us were in
Mm.
lockdowns. But I think the time has come for us to ditch this comfort 10 and really take
And shake it
control
off.
and
Yeah.
and try
Yeah.
to take it off. I mean, I'm still battling it myself,
Mm.
but
Mm.
for now, I'm using myself as a guinea pig to see what
Okay.
works. And as I know that I'm a physician, I'm still working in a pandemic. It's not easy. It really
Yeah.
isn't. So I do whatever I can to manage my stress. I exercise as often as I can. I
Yes.
prioritize certain things. I make sure that I get up on a morning and do my meditation. I watch what I eat. Um, but I'm also not, I do it 80% of the time. So 20% of the time, I allow myself to have some fun. So I want a
Okay.
cupcake. I'd buy the mini cupcake, or if it's a large one, I'll cut it in half.
Okay.
I'm done
Yeah,
with
the thing
pork.
is not to starve yourself completely, then the
No.
cravings just become even
Yeah.
more. So
Yeah.
let's finish off with who is Dr. Tanya, the woman? I know
I
you're a
have
mother. How many children do you have? How
I
old are
have
they?
3, 28, and by the
Mhm.
end of this year, I will have a 25-year-old and a 21-year-old. I have 2 boys and my daughter. My daughter
Okay,
graduates from university, hopefully, knock wood, cross fingers, at the end of the year.
right.
So I'm looking forward to this new chapter where, the children have finished university and they're all, going to spread the wings that I
Yes.
guess I've been part of. Married to a wonderful husband. It's when I think about it, and as I said, today is Doctor's Day, and I think, man, as a child, I knew I was going to be a doctor. I was one of those poring over this books that my parents had called Modern Ways to Health, and I would read it through. And I remember once I was about 9, diagnosing my aunt with stomach flu. And
Oh,
I said, "You just have
wow.
stomach flu." And they're all looking at me. "What is stomach flu?" I said, "I just read it. Read that." That was my first diagnosis, and I felt so good because it was right.
Oh,
I was right. She had stomach flu,
you were born to
and
be a doctor.
and I just knew I was going to do it. But I didn't expect that it would take me through. It would take me through Western medicine, back to the ancient medicine, and then back into
Yes.
the midst of a pandemic in 2021, where we know nothing really. We know
Yeah, it's
nothing.
true.
We know
It's so
absolutely
true.
nothing. We what we thought we knew has been thrown out the
Yes,
window. Nothing is
completely.
working completely. So we sort of have
Mm,
to look at the work. I look at the work that I do through a whole new lens. I'm very clear
yes.
now that I have to look at each person based on their past experiences, their genetics, their current experience, and so many
Yeah.
other factors. Um, just hold space for them to transform their health and their lives. So it's been quite an eye opener, this pandemic, I have to say.
Wow. Well, thank you so much for coming on the show today. Thank you so much to everybody who's tuned in. I think we have received a few nuggets of wisdom from Dr.
Thank you.
Tanya in terms of women and women's health and how we can look after ourselves. A parting thought: is there anything I should have asked you that can help women during the pandemic to take care of
Uh,
themselves better?
Give yourself a little break. There's no right way to do the pandemic. There is no
Mm,
right way. But you still want to eat whole, unprocessed foods. You want to make sure you stay hydrated with water,
mm,
cut back on alcohol. Try to exercise. I know many of the gyms are closed, or you don't want to go
yes.
to the gym. But you know what?
Go
The
for a
internet
walk.
has opened. No, but the internet has opened. A lot of gyms are
Uh,
now online. You can take classes
yes.
online. I mean, I so much has opened up for me because I'm beyond St. Lucia now. I've gone to other parts of the world working out with people who, I would never have gotten a chance to do it in person. You
Yes.
can
Yes.
exercise. Make sure that you manage stress in a healthy manner. If a lot of us are disconnected and lonely because of the, physical distancing. And so reach
Yes.
out. If you struggle, and reach out and speak to your healthcare professional or somebody
Yeah.
who you trust.
We can help you. Yeah.
Sleep. We all Netflixing and staying up late watching it, but
Mm,
the greatest anti-aging tool is sleep, good restorative sleep.
okay. Excellent. And how
And
can
don't
people
forget
get
to
hold of
connect.
you?
I am on, my website is tanyabeaubron.com.
Hmm.
I'm on Facebook as Tanya Destang-Beaubrun, or you can get me at Satya Integrative Medical Services, which is my baby, my clinic. I am on Instagram as Dr. Tanya Beaubrun, and I'm also on LinkedIn as Tanya Destang-Beaubrun.
Fantastic.
So yeah,
I will share these links with this video. Thank you so much for coming
thank you.
online today. Wonderful to meet you.
Same
And
here.
goodbye, everybody. Have a fantastic day wherever you are in the world. See you at the next Her Story Online Summit.
Thank
Thank
you,
you so much,
everyone,
Dr. Tanya.
and please be safe. Take
Bye
care.
bye.
Bye bye.